Director General of Ghana Health Service. What protocol of service? Carry the mic for the thing in my head. Sorry if I leave you out. Beatrice Cooper, thank you for all what you said about me, but you've confused me. Now you make it difficult for me to make certain statements that I would have liked to make. Anyway, thank you, because you have worked with me, you have been one of my nurses, and so...
State member, Upper West Region, and I deem it a privilege to be the one to do it. History is about to be made in the Upper West Region. For many years, the people in this region have been waiting and yearning for the day that a regional hospital befitting it will be constructed. That day has finally come. And what a joy it is to be here and be part of it. I therefore deem it a great pleasure and an honor to be called upon to say a few words before you are formally welcomed to the region by the regional minister. We are about to sow a seed in the health sector in the region which would dramatically transform the landscape of healthcare delivery in this region. Healthcare delivery in the region is beset with many challenges, the main ones being infrastructure and the human resource for health. In the case of infrastructure, out of the 9 political districts we have, there are 4 that do not have hospitals at all. And in fact, the region does not have a befitting regional hospital. In the case of human resource for health, the situation is very serious. At present, as I speak, we have a doctor population ratio in the region of 1:75,000. This is worse by all standards. That of other critical staff like midwives and medical assistants is equally serious. And most of our midwives are 55 years old and above. This situation does not augur well for quality healthcare delivery. And we in the Upper West region believe that inadequate infrastructure, poor equipment, all contribute to creating poor working environments, a situation which also contributes to the reason why staff refuse posting to the region. It is in the light of this, Mr. Chairman, that we believe that the presence of a modern referral hospital with modern equipment in the region will be the beginning of the end of the chronic shortage of the staff that leads to poor health outcomes, very much as what the chairman alluded to earlier. For example, even as I speak now, before the construction starts, one gentleman has already volunteered to come to the region and work. Our joy is further increased by the choice of WA out of the many other venues to be the venue not only for the sword cutting for the construction of the Upper West Regional Hospital, but also for the official launching of the Ghana No. 8 hospital projects by no mean person than His Excellency, the Vice President of the Republic of Ghana, which is a clear demonstration of his love and concern to see an improved health status for the people of the region. Mr. Chairman, His Excellency, the Vice President, members of the Council of State, all protocols observed. As we mark this day, I wish to urge all of us to soberly, objectively, and genuinely reflect on how we, as sons and daughters of this region, can contribute to make this structure bring the desired impact to the healthcare delivery in the region. Specifically speaking, I think that we need to think through how to attract and retain the much-needed human resource for health in the region. May I therefore, Mr. Chairman, with the permission of Your Excellency the President, charge the Chairman as Dean of the Medical School of the UDS and as one who is the embodiment of healthcare in the region with the responsibility of ensuring that this modern facility takes its place as a center of excellence in the provision of healthcare services in the region. May I also further charge, with again the permission of the Vice President, the Director General, the Chief Director, and indeed the Minister of Health to assist the Chairman in this direction. I wish to entreat everyone to let this hospital realize its full potential in being a center of training as part of the mandate of the medical school in the University for Development Studies. I believe that posterity will not forgive any of us seated here, and especially you, the Chairman, and the other two personalities I mentioned, if this laudable project becomes a white elephant. Mr. Chairman, Your Excellency, all protocols observed, I wish to assure you of our commitment as a service in the region in providing client-friendly, rights-based, comprehensive health packages in concert with families, communities, and all stakeholders within a sustainable health financing mechanism that will be responsive to the needs of the people of the Upper West region. On this note, I thank you all for your attention. Thank you.
Stepped out on the soil of the region with His Excellency the Vice President, who has come to launch a project that we are all dear to in this country. But particularly, I'm happy that the Upper West region, is on that list that is to provide health facilities for our people. And I couldn't have been luckier than this, because this is one of the felt needs of the people in Ghana generally, and particularly of people in this region. But going to the text, on behalf of the chiefs and people of the Upper West region, I wish to warmly welcome Your Excellency, the Vice President of Ghana, to WA. I also wish to warmly welcome all dignitaries from Accra and other parts of the country who are here to grace the occasion to grace the occasion. To our traditional leaders and the general public who have made it to this function, I say a warm welcome to you all. Mr. Chairman, since the creation of the region, over two decades ago, the WA Municipal Hospital has served as its regional hospital. Owing to